It takes something like 10 to 20 years for a new idea that has been kind of scientifically vetted to make it into traditional mainstream workflow within the clinic. I think part of that 20-year gap is the educational cycle that happens in healthcare. So the instructors and the people who are experienced enough to be teaching in med schools and residencies, they they're comfortable with the equipment that was around when they were practicing, and it's been 10 years since they were, first started out. And so then they instruct their students, and then by the time those students get to the point where they could possibly be instructors, we've got that kind of 20-year cycle going. I think that kind of explains some of it. And then another thing that contributes to that is the um, recent emphasis on evidence-based care. So we are very reluctant to integrate anything that doesn't have a really strong evidence base, and it takes years to generate that evidence base. So you may have, you know, a round of clinical trials that suggests that this product is safe and effective, but maybe they want to observe patients after they have used the product for 5, 10 years. And then again, you have that multiple year gap coming through. It's a gap that we don't see in other parts of technology. And as innovation in the rest of technology accelerates and healthcare kind of remains the same at this 20-year gap, the difference between expectation and reality gets wider and wider apart. So you have this kind of funny phenomenon where, in the clinic, it's still totally normal to use a fax machine and a pager on a daily basis. Whereas if you did that in any other sector, people would laugh at you, right? They'd be like, the 1980s are calling. Um, we're
Faxing, right?
stuck. We're stuck in that track because that's what the current workflow calls for. And, of course, things are going to change slowly over time. We're going to transition to using our cell phones that we're already carrying anyway. But by then, who knows where the standard tech will have advanced to.
Yeah, the doctors will be using smartphones when we're gonna have, I don't know, AI-enabled glasses, maybe?
Right,
You
maybe.
know? Exactly.